That's an interesting way of getting here. And as you spoke about both brain health and mental health, a lot of people don't recognize the connection between those two, um, even though they're separate terms. They're very interconnected. You also mentioned veterans as a part of that conversation, and I've heard that you have sort of a soft spot, if you will, for that population of people. When we talk about brain health and mental health, that's a subpopulation of people that is very highly impacted by those things, much so than their non-veteran counterparts. In your work here, once you assume the position of executive director at the American Psychiatric Association, and began your work here, talk to me a little bit about what it was like when you arrived, where you are now, and looking at that sort of subpopulation of people. What's been done around that group that to help sort of mitigate, reduce, if you will, the numbers that are impacted by both brain and mental health issues.
So the platform that the APA Foundation sits is to promote the mental health and well-being of individuals and communities where they live, learn, work, worship, and play.
Mhm.
And when I looked at our platform, the place where we live seemed to be the place where we're putting the least amount of time and the least amount of resource. And so live. If you're going to say where we live is the first pillar,
Mhm.
how does that look? You know, when it comes to schools, we can show you quantifiably what we're doing around schools. When it comes to faith, we can show you quantifiably. When it was live, it was a little squishy. And so borrowing some of the work that I helped lead at AARP, live really became disaster relief and some recovery and working with military and veterans families. And some of that started because when now Congressman Anthony Brown was Lieutenant Governor of the state of Maryland,
Mhm.
his office reached out to me when I was running Maryland AARP back in 2009, 2010, and said, we have too many retired veterans between the district line and the Delaware line. We need to do better by them. And many of them are 50 and old. What can we do about the older aging veteran
Mhm.
who needs help? And so we worked on the first stand down in Baltimore City that they had ever had. And then we had our own symposia. But the one learning that I didn't have at AARP that has helped me, I think, the most at APA and the APA Foundation is that we weren't always tapping into veterans to try to be helpful. So sometimes in our efforts to be helpful,
Mhm.
we create more problems because we didn't speak the dialect. We didn't really understand the culture, but we knew we wanted to help. And they're like, well, regardless of whether they served, they're 55 years old, they're 65 years old, they're 75. And sometimes when we did some outputs, we were very surprised by the outcome,
Mhm.
inconsistent or worse. And then that was where I learned if you want to work with this very treasured, respected, and very hard position of people who have done hard things in hard places
Mhm.
and are hard to reach, then you need to be talking to them about what they need. You need to be talking to them about how they want it delivered
Mhm.
and who will be the face and the voice of talking to this community about the things they need. So I think that has changed because now we're targeting partnerships as a way of driving it. And so we're trying to amplify the work that our partner does and not so much that the APA Foundation is doing X, Y, and Z.